Thank you, Joshua, for that very generous introduction. It's great to be here. Thanks, everybody, for coming on a rainy election day. Let me just say before I forget, feel free to interrupt with questions along the way. Happy to make this more interactive. This is a talk where I'm going to present results from an ongoing project that tries to look at the effects of imprisonment on various outcomes, in here recidivism, employment, and health. And we're doing so by leveraging a natural experiment based on the random assignment of cases to judges in the state of Michigan. Right? So the basic idea is that you randomly assign to your judge. Judges, for better or worse, have very different tastes for punishment and for sentencing people to prison, so that gives us some exogenous variation in who goes to prison and who gets a different sentence, like probation. That's our main comparison here. Let me also say that it's presenting this work today, a few days after Diva Pager passed away, is a little difficult, but you'll see that we engage pretty heavily with her work, and I'm sure many of you remember her quite well. I think she was on the faculty here. Really important scholar in this area, and she'll really be missed. I just wanted to share one quick story with you about Diva and the impact of her work. I've been teaching an Intro to Social Methods course at Berkeley, 240 undergraduates, and one of the first papers we read is Diva's marked paper from American Journal of Sociology. And the first time I taught the course, I had a group of formerly incarcerated students in the course, and that work inspired them so much that they've now gone on to conduct some of their own research on the impact of stigma and labor markets. And so that's just sort of one example of the many ways that we've been touched by her work. So, well, let's get started then. Just want to acknowledge my collaborators and our funders. Especially Jeff Mornoff, who's been my longtime partner in this line of research on prisoner reentry, and some of our other collaborators. I'm going to briefly motivate and then talk more about the study design. The focus of the talk is really going to be getting through a set of empirical results that in some ways build on one another. You have to understand the recidivism results to kind of make sense of some of the employment and mortality results. And then, if there's time, I can say a few things about what we're doing next in this project. So the motivation is pretty simple. There's been now decades of work on the consequences of high levels of incarceration, especially among sociologists and other social scientists. From a theoretical perspective, we've been very interested in the role of mass incarceration and inequality. That motivates our interest on things like employment, and also the justice system as an especially strong and present form of social control for racial minorities and the poor, particularly in urban areas. From a policy perspective, we should care about the effectiveness of imprisonment as a crime reduction strategy, and also about the collateral consequences of its use. So making effective policy decisions really requires us to sort of unpack a little bit where imprisonment effects are happening and where they're not, and perhaps why. So the prior studies that have tackled these, at least at the sort of micro level where we're working with individual level data, have basically used two strategies. One is to use longitudinal survey data with random or fixed effects to follow people over time as they're incarcerated or not. There are some more seats up front if folks want to sit down. And those studies find that incarceration reduces future employment and wages, and then presumably leading to greater inequality. And there's also some evidence that incarceration leads to higher future risk of incarceration and criminal justice system involvement, the so-called revolving door prison. The limitations of this is that there's sort of poor measures of incarceration, things like survey, whether you were surveyed in prison, which kind of results in a fuzzy comparison group and a poorly defined counterfactual. so who are we really comparing prison to? Or is it folks who actually have some chance of having gone to prison, which can bias our estimates? And then often a fixed effects strategy, isn't really going to deal with time. Will only deal with time invariant confounders. So these questions leave open questions about causality. And then there's been a set of natural experiment studies, research designs very similar to ours, that tend to find much weaker effects, or none at all. But those studies, because they're trying to capitalize on a natural experiment, often work with very specialized subpopulations in specific places, a particular city or county. Haven't actually dealt with the various sort of package of sentences that people can get. And often, I think the biggest weakness is they just have small sample sizes. You need a lot more power to do this kind of analysis, and we end up with the inability to detect even somewhat large, what would be large effects, and look at variation by subgroups. We're able to do that here because we have data for a whole state for 4 years. One exception is this Mueller-Smith paper that people who work in this will be familiar with, which does work in one county but has data over many, many years. The big difference here is he kind of combines jail and prison together into one treatment. Okay, so our study design is, as I said, the natural experiment based on the random assignment of judges to criminal cases. These judges have very different tastes for punishment. That's great for social scientists. Not so good if you're the person who's randomly assigned to the harsh judge. We have an indicator for each judge. And that's going to be our instruments along with interacting those with the covariates, and I'll say a little bit more about why we do that. That's following the Mueller-Smith strategy. For the results I'll show you, the very basic two-stage least squares estimation, and we use county fixed effects because the randomization occurs within counties and county courthouses. So we need to deal with throw out all variation across counties. Here we have a clearly defined counterfactual. We have a set of people who could have, in principle, gotten a prison sentence but did not. We're following a large cohort of individuals. We have data on everybody sentenced in Michigan over a 4-year period and follow them over time. Various administrative records linked together, and we can look at various subgroups, and particularly race and work history are going to be important. Just a quick review of the logic of instrumental variables. So we're interested in the effect of, I don't know if you can see that, the effect of sentence type on some outcome, either employment, a measure of recidivism, or mortality. And so we're interested in this B as our treatment effect. Right? So our normal strategy in a regression model would be to control for a set of observed confounders, break the backdoor paths between D and Y. We can, of course, worry about unobserved confounders, right? There's many things that may determine someone's sentence. For example, that the judge sees that we as researchers don't see in our data. And so this is the kind of the problem with the regression approach. And an instrumental variable design says we have an instrument, which is often called Z, which affects what sentence you get, but doesn't otherwise affect the outcome, right? So your judge harshness affects whether you go to prison or probation, but isn't related to in any other way to the outcome, is our assumption, right? So, and then we estimate, in a very simple sense, we recover B by taking the relationship between judge harshness and the outcome, which is A times B, and dividing it by A, right? So that recovers B for us, AB divided by A. So there's a couple more assumptions, right? So we could be worried that the judge harshness isn't completely independent of these other things. If it's not independent of observed things, that's fine, we control for them. The real assumption is this exclusion restriction, that there aren't other pathways through which the judge affects the outcome. Right? So an example would be if, we don't believe this is the case, but you could tell a story where especially harsh judge is especially mean to a defendant in the context of the courtroom. That affects their perception of the fairness of the law, and then maybe affects their recidivism later, right? So if you told that kind of story, that would be another way that the judge affects the outcome other than through the sentence. Okay, so these are our three usual assumptions. Relevance, we have to have an A here, and it has to be something larger than 0. And I'm happy to take questions about the strength of the first stage if people are interested. Exogeneity, right, that's the exclusion restriction. And then there's monotonicity, which is that the judge harshness always affects the sentence type in the same direction. So in this context, you could imagine that one judge might be especially harsh on drug crimes, and another judge might be especially harsh on violent crimes. And if that was different enough, that would create a problem. The way we solve this is the Mueller-Smith method, which is to interact the judge with the covariates we have, and that allows that first stage to sort of differ based on what your covariates are, like what type of crime. So that's the basic logic. The important thing to keep in mind in interpreting all the results is that these are going to be what are called local average treatment effects. Any IV estimate is a local average treatment effect, and what that means is that it's the effect for those people whose treatment was changed by the instrument. Changed, in this case, changed by the judge. So that's going to mean it's the people for whom getting the harsh or the lenient judge actually mattered for their sentence. There's going to be some people, based on what they did, they're always going to go to prison. Some people, based on their criminal history and the crime they committed, are always going to get probation. So what we're doing is not informative of them. We're people on the margin. And so this is kind of the policy margin, I think, or at least one interesting policy margin if we're interested in, shifting the harshness or leniency of sentencing around probation versus prison. These are the people who we'd be shifting around. Can't tell who those people are in the data, unfortunately, with this complicated setup. But we think this is not a particularly narrow group of people. We've looked at, how the judges move people's sentence in lots of different subgroups. We see that movement in lots of different subgroups, and we also have this sort of county variation, because the role of the judge is sort of relative to other judges in your county. So in some counties, the lenient judge is still sentencing maybe 50% of people to prison. In other counties, the lenient judge may be sentencing 10% of people to prison. Right? So because we're aggregating across these counties, we're getting sort of potentially a wide range of people who are impacted by this, or different types of people at least. So a little bit more about the data briefly. This is administrative data we collected with the help of the Department of Corrections in Michigan for everybody sentenced for felonies 2003 to 2006. For recidivism, we can follow them through 2015. For employment and mortality through 2012. We have to exclude some cases, because these are ones where the judge is not randomly assigned, or the penalties are sort of pre-specified. But we still end up with 110,000 cases across Michigan's 35 largest counties. And then the employment data come from unemployment insurance records, so everybody's quarterly employment and earnings in the formal labor market, and mortality records from the National Death Index. And I'm happy to talk a little bit more about the matching if people are interested in that. So of these, I should also say, of these 110,000, about 20,000 of them are prisoners, and about 42,000 get probation. There's other sentences you can get just sentenced to jail, or sentenced to a combined sentence of jail with probation. We're not focusing on those in this analysis. They're still in the models because we have to account for all those possible sentences, but we're just going to look at the coefficients on prison versus probation also. Probably the trickiest thing here is this question of how to define the risk period. So for probationers, it's pretty simple. Once you get the sentence, you're released into the community, you're kind of at risk of all these outcomes. For prisoners, though, it's more tricky because you're sentenced to prison for some period of time. And so we could start your risk at the sentence date. And that would build in a lot of incapacitation effects, or what criminologists call incapacitation effects. So if you're sitting in prison, you can't commit a crime in the community, you're certainly not going to be employed. You are still at risk of dying, but much lower. So that's one approach, is to start the risk at the sentence date. The other is to just start at the release date. And the main thing that does for us is it removes those incapacitation effects, which can be kind of swamp the other effects. So this area in red here is sort of eliminated. So basically, we're going to solve this problem by doing both and looking at the results both ways. But why do this? The sentence date provides kind of the purest counterfactual comparison. We're comparing people starting at the same point in time. It reflects the full impacts of the judge's decision. From a policy perspective, the judge is thinking about incapacitation when they sentence somebody. And it can also then reveal the magnitude of these incapacitation effects, which people haven't really paid attention to in the literature. It's less useful for understanding the long-term effects of imprisonment because of the sort of the large magnitude of the incapacitation effects, and I think that's why a lot of people actually haven't done this in prior studies. The date of release is the conventional way of doing things. It removes the incapacitation effect but introduces some potential problems. One is that your release date is not sort of purely determined by your judge. Right? How well you behaved in prison, what programs you did, how you presented yourself before the parole board, so a little bit of endogeneity creeps back in here. And then we're going to be able to follow people for different amounts of time. Now, some people aren't going to even get out of prison in our observation window. So you kind of have to take the release results with a little grain of salt with this in mind. Okay, so on to the results. I'm going to try to move through the results pretty quickly. If people have more methodological questions, feel free to interrupt. Okay, future felony convictions and imprisonment. So what are the basic theories here? For a long time, criminologists thought of prison as primarily crime preventing. Right? So you incapacitate people, that's pretty straightforward. There's a deterrence argument, and prison has some rehabilitation and transformation potential. More recently, we've been focused on the negative effects of prison, stigma and labeling, erosion of human capital, social capital, prisons as schools of crime, the trauma of experiencing prison, building criminogenic networks, and so on. And then finally, I think the piece that will turn out to be most empirically important here is parole supervision effects. So what's going to matter here is actually that when you come out of prison, you're put on parole, you're under supervision of the criminal justice system, you're being watched quite closely, and so you can be put back in prison, not for committing a new crime, but for violating the terms of the parole. And to preview the main point, a lot of the to the degree that the revolving door of prison is causal, right? Not just the fact that people who go to prison are more likely to commit crimes in general, but to the degree that the revolving door of prison is causal, it's really due to these parole supervision effects that we're going to show you. Okay. So there's a lot on this graph. The main thing I just want to, these are the graphs of the outcomes. So this is going to prison for any reason, for a technical violation or for a new crime. And then the bottom one is whether you've actually been convicted of a new crime. And we do any felony crime, and then we sort of look at medium and high severity crimes. The main point, and then so we have people going to prison by race, and then people going to probation by race. So you can see quite big differences there, not surprisingly. This is even after release, so we're already measuring the prisoners from release, not with the incapacitation effect. That's why you see the higher rates for prisoners. The main thing is just so you can see like the sort of scale of the outcome, right? So just, somewhere between 0.35 and 0.45 is the return to prison rate for the people who go to prison. Something closer to 0.1 for everybody else.
Hispanic whites?
This is Michigan, so yes, good question. These are, and this is why there are very few Hispanics in Michigan, period, and even fewer of them in the criminal justice system. So this is.
So it's basically mostly non-Hispanic white, mostly non-Hispanic black.
Yes, yes. And that is a big weakness of this, is that we can't look at Latinos or Asians. Okay, and so just also to get the sort of magnitudes, right, we're also new felony convictions within 5 years are 0.35 to 0.45 for the prisoners. So you have some scale when we look at effects. Okay, so these results are from release, right? So we've eliminated the incapacitation effect. And these are just the same outcomes we looked at: prison admission, technical violation, and admission for a new sentence. And what do we see? We see positive effects on new prison admissions. That's the prison's revolving door having causal effects by 5 years. For non-whites, the magnitudes of these are almost identical. It's about 20 percentage point increase in the probability of a prison admission within 5 years. But if we look, most of this effect is being driven by admissions for technical violations rather than for new crimes. Okay. That's especially so for non-whites. For whites, there are more new crimes going on. So that's the revolving door story. If we then look at the convictions, right, we see there's very few effects. We're not able to detect really small effects given the size of our standard errors, but for the most part, the effects are either negative among non-whites, slightly negative, and they're never significant among whites. So we're not seeing a story where going to prison has this sort of criminogenic effect. You commit new crimes. We're seeing a story where going to prison puts you out on parole, which then puts you at risk of reincarceration again. What's the actual incapacitation effect? Now we're looking at from sentence, right? So we're building in the incapacitation effect, and the simplest thing to do is just to look in the first year, when about 87% of both whites and non-whites are still in prison. So that's a pretty good place to look for what's the incapacitation effect. Of course, this is going to be based on the comparison group, right? How many crimes are the probationers committing in that first year while the prisoners are incapacitated. And so we do get statistically significant effects, pretty similar for non-whites and whites. They tend to be concentrated among the lower severity felonies. And they're, I would say, they're modest, I would say. So, in our public discourse, we often hear that every time we put someone in prison, we prevent a crime, right? And this is telling us we are very far from that. Okay, so prison's revolving door has real causal force. The mechanism is largely about post-prison parole supervision and parole violations. And so that means that part of the rise in imprisonment that we saw, if this generalizes to other contexts, was really that the criminal justice system is self-perpetuating, right? We're bringing people into the system itself keeps them in the system. Okay? So that's part of the story of where mass incarceration came from. The incapacitation effects are non-trivial, but not as large as we would say. So if you just take the inverse of those effects that I just showed you, you get preventing a single felony in a year requires imprisoning about 15 people who are on the margin. So that helps us think about the costs and benefits of that. Okay, so on to employment. Could there be positive effects? Could argue that there's substance abuse and mental health treatment in prison. People get more education in prison, especially GEDs. We've argued in our qualitative work on prisoner reentry, this is kind of a reentry moment where people are engaged and focused in kind of creating a conventional lives for themselves that comes from this sort of period of reflection in prison. It doesn't always last, but that could be part of the story. And then other rehabilitation. Of course, then there's negative effects, the incapacitation effect being an important one. Stigma and labeling, back to Diva Page's work. There's also been an argument that stigma not just prevents you from getting a job, but pushes you into the secondary labor market. And this is actually the only theory we can address directly with our data, because we can measure that in the data. Human capital erosion of your social capital and social networks, and then the same kind of mental and physical health effects. Okay. So what's going on? Here's our descriptive data. In this case, the descriptive data really tells the story. We might not even have to do the natural experiment. So this is following people. So we're going to exclude incapacitation here. So the time when the prisoners are in prison is not on the graph. It's kind of sliced away. 0 is the sentence or release point. Sentence point for probationers, release point for prisoners. And then we're just plotting the probability of employment for by race and by whether you went to prison or or probation. So the filled-in circles are prisoners. Darker, the black on the screen is blacks, and then the gray is whites. So there's a few patterns you can see immediately. One is just the very low levels of employment, at least in the formal labor market, that we see, period, across. The highest is this white people eventually sentenced to probation end up with 50% employment rates. So this is a population that really struggles with employment, period. There are racial disparities both before and after prison. I think importantly, from a methodological perspective, we see declines in employment pre-sentencing. Okay, so this also should force us to question whether methods that rely on kind of looking at common trends are going to work, fixed effects methods. We of course see a big drop in employment right around the time of sentencing, right before sentencing. That's from pretrial detention, so that's not surprising. And the other thing you can kind of see here, you'd be able to see it better if I just showed you the numbers, I guess, but is that by race, the gaps certainly don't widen, and in some ways they shrink a little bit. Okay, so it's hard to look at this and say, oh yeah, there's definitely an effect of prison there, right? That if I, other than this little this dip here while people are in pretrial detention, say take blacks who've been to prison, this line just seems to kind of pick up right where it left off. Okay, and same for whites, and the probationers are having the same downward trend as well, actually. Okay, so that's kind of a big part of the story, is that we're not actually going to see employment effects of incarceration, at least not after release. This is the same picture without slicing out the incapacitation. So now this is the sentence for everybody, and so now you can see the incapacitation effects, right? So you can see that there's a big drop right here around the time of sentencing, right afterwards in the employment rate of the people who go to prison, both blacks and whites. Blacks are much less likely to recover, but both groups drop. So this suggests we're probably going to see some incapacitation effects. And so that's what we see. So this is looking at sentence, and so we just pick certain calendar quarters to look at in the UI data. The fourth quarter is after the first year. And the AJS reviewers wanted us to call it blacks and whites rather than non-whites and whites, so that's why the table changed a little bit. And what we've done here is we've stratified by the analysis by not just race, but also by work history, because this is going to be important. So we see an overall effect, but we see big differences in effects by prior work history. So have you ever worked in the formal labor market? For both blacks and whites, the incapacitation effects are much larger for people who have a work history, not surprisingly. But there are still incapacitation effects. So about 4% of the blacks would have been working had they not gone to prison, 9% of the whites. And so especially relative to the employment rates in this population, these are I think, not trivial effects. If we look post-release, the story gets quite a bit different. So we can look at so here's the fourth quarter after release for the prisoners, fourth quarter after sentencing for the probationers. We see that these effects are actually positive. That means among blacks without a work history and among whites without a work history, very similar effects. And the only place we find a negative effect is for whites with a work history. They're the ones with something to lose. Now, it's important not to get too excited about these positive effects among folks without a work history, because these effects fade away over time. Okay, if we also look at the 20th quarter, right, 5 years, they're almost gone. So there is this kind of bump in employment after prison that seems to be causal. but it fades away. Right? And, oh yeah.
Is that driven by conditional relatively?
That's not something we can tell in our data. I don't think so. And this is just more speaking from our qualitative data on prisoners coming out of prison, who found very little success in Michigan with these kind of conditional job placements. That could be, but in other contexts where those programs were running better, we might imagine such an effect. Can't really say here. Okay, so I know I'm moving quickly. I want to get to the mortality results also. Implications. So incapacitation effects are the largest effects of imprisonment on employment. And if we understand that, and if we think back to those revolving door recidivism results in re-imprisonment, then we're kind of getting a secondary incapacitation effect as well on employment, which is that being sentenced to prison doesn't just lower your employment when you're in prison, but when you come back out again, you're at high risk of re-imprisonment, and then you get another hit on your employment in the future. The post-release effects are limited to whites with a work history, the most advantaged workers. I didn't show you the results, but we see no evidence of people being moved into the secondary labor market. I think that's largely because most of these folks were already in the secondary labor market. There's really nowhere else to go. And I think given that these are incapacitation, most of the effects we see are incapacitation effects, what that's really meaning is that a lot of the effects here are being driven by the poor outcomes of the probationers as well in the labor market, right? So it's not possible to do much worse than the probationers in a lot of ways. And so what this means is that if we look at this at prior audit studies, like Diva's work and all the work that it inspired, one criticism of those studies is that they sort of conflated the effect of prison and conviction. Right? So the actual experimental manipulation is have you been to prison, and that's how a conviction is signaled. So if you combine our results with those, what we're really seeing here is that the effect that those audit studies are picking up is the effect of a criminal record, not of imprisonment per se. And so from a practical perspective, if we're trying to improve folks' employment by simply diverting people who would go to prison to probation, that's not going to be very effective, right? We need to intervene much earlier in the criminal justice system process where people are getting arrested and convicted. Okay, the mortality results are preliminary and unpublished. We're still working through them. I'd be curious to hear your reactions. So we know that individuals who experience imprisonment are considerably less healthy than those who do not. Mental health problems, substance abuse, and chronic medical conditions and infectious diseases, those have all been documented. The weeks immediately after release from prison are particularly risky, especially for overdose deaths. Prison itself, just at a descriptive level, appears to be protective, especially for black men. You're kind of confined in and controlled in a particular space, reduces the risk for lots of common causes of death, which I'll show you in a minute. And there's some studies that show that if we just condition and observe covariates, there are potential causal effects of imprisonment on health. Okay, so this is our data. So this is data now on causes of death for everybody in the sentencing sample. So this also includes people sentenced to jail and jail followed by probation. Just to give you a sense of the type of risks, the health risks that these folks encounter. So what I've done here, these are just kind of the standard way of breaking down the National Death Index causes. Blue are external causes and black are internal causes. And I've sort of ranked them by the difference between our criminal justice involved population, those sentenced for felonies, and the non-institutionalized population in Michigan. Okay, so we look at these standardized mortality ratios, standardized by age, gender, and race. Okay, so for just any death, right, the death rate is 692 per 100,000 person years. The SMR is 2, right? So double the risk of death than, compared to the population of Michigan. The places where there are the biggest disparities, perhaps not surprisingly, are overdose, this very catch-all thing called other external causes, homicide, suicide, other types of accidents. The internal causes still have pretty big discrepancies as these kind of SMRs go, if you've worked with these before. It's a very unhealthy population, but of course they do get smaller when we start looking at the internal causes. So this just gives us a sense of sort of baseline what the risk of mortality looks like. So there are kind of two sets of stories about effects of prison on health. So there's the negative arguments are that prison is a very bad environment for your mental health and also for stress, which can have pathways through like cardiovascular health and so on. Prison is not a good place to be if you have mental health problems and can exacerbate them or cause them. You have limited autonomy to practice your own self-management and care, limited social support, which we know is important for people's health. Cumulatively over time, then that stress accumulates. You also then have more and more exposure to communicable diseases in prison, and your social support may decline over time the longer you're in prison, people on the outside. And then there's also this sort of what we're calling churn, which is the experience of going in and out of prison, or the revolving door again. How's that going to affect your health? Potentially, there's this sort of stress of reentry. There's healthcare transitions, the problems with continuity of care. The overdose story that people have told is largely about your loss of tolerance to alcohol and drugs, and that leading to overdose. And then also risk of violence after release. Right? You've been in prison. You're back out on the streets. All your sort of strategies around social networks to protect yourself from violence are going to be harder to reconstruct. There's also potential for a positive story, much reduced but not zero exposure to or availability of alcohol and drugs. This is a big limitation on accidents, which is of course a huge cause of death among the age of people who are in prison, and limitation on violence, so it's not zero. Right, so we saw the importance of car accidents, homicides, suicides. You are getting regular food and shelter. Our research on prisoner reentry shows that even just maintaining regular food and shelter is very difficult for this population. And you do get some measure of health care. And that's sustained over time in the ability to have disease management and taking your statins and so on. And the churn could be positive through health assessment, right? So for example, every time you go into prison, you're assessed, you're tested for many communicable diseases, and then if you have them, then the prison treats you for them, right? Including HIV, at least in the modern, in the time that we're looking at here. I don't think that would have been the case 10 years earlier. Okay, so which way might it go? So we need to change the study design a little bit here, right? So the employment and the recidivism I showed you, we just sort of said, okay, let's look at what treatment someone gets at sentencing, and we'll compare those two groups of people over time going forward. Now we have, in order to sort of pull these possible health effects apart, we have time-varying treatments in a sense, right, or time-varying interventions, right? So whether you're currently in prison, the total cumulative time in prison, and the number of times you've entered prison, which is our measure of churn. I suppose we could have used exits from prison too, but basically it's the same. And so that requires us now to have a longitudinal framework with time-varying treatments. So we've done kind of we've had to marry survival models with the instrumental variables analysis. And so we've implemented discrete time survival models with a linear probability model that we've replicated them with using logits and probits as someone might normally do with a discrete time model. The unit of time is months, so have you died in that month? And now we're able to use all cases because even the people who are originally sentenced to jail or jail with probation have some probability of ending up in prison as we follow them over time. The tricky thing here is that we only have the randomly assigned judge, our instrument, at the baseline, right? So how are we able to look at treatments over time? The answer is that is part of, again, back to the revolving door, right? So what sentence you get at baseline is going to affect your criminal justice contact and involvement way far into the future, both through the revolving door and also because the judges have an impact on the length of the sentences you get. And so this is a kind of a crude way of doing it, but this is the standard that we can look at the usual F test for the first stage for each of our treatments. So does your judge predict, this is just the F test statistic, these are all significant because we have so much data. Does that, do the judges explain variation in whether you're in prison at 6, 12, 18, 24 months, etc. after the sentence? Does it explain the cumulative prison time, and does it explain the number of prison admissions? So we're getting a pretty strong first stage. The 10 is the usual cutoff. We need to do more of this. If people have suggestions about what else we should be doing here, I'd love to hear them. So, but it does look like the judge at at baseline is impacting your criminal justice contact way far into the future, at least as far as we can measure. So here's the all-cause results. Pretty simple. So now we have three treatments. We're looking at this for everybody pooled. These are the coefficients in the models, but hard to interpret because this is your increase in risk of death in a month. So if we multiply this by 12 and then by 100,000 to get back to our 100,000 person years metric, we get a huge reduction in your risk of death while you're in prison. The cumulative time you spent in prison doesn't seem to matter, whether that's because it doesn't matter or just because there are countervailing effects that are canceling each other out. We can't really say with our data. And then the count of prison admissions, this churn does seem to increase your risk of death. We can get a little bit better purchase on this by looking at the specific causes, try to understand a little bit more what's driving this. And so instead of showing you those coefficients with all the leading zeros, I just showed you the change in the rate per 100,000 here. So this is just cause-specific models. And so we can see that the protective effect of being in prison is driven by a lot of these external causes, right? Lower risk of overdose, accidents, homicide especially. There are actually still protective effects of being in prison on things like cancer, cardiovascular disease, respiratory disease. Cancer, by the way, is like 30% lung cancer deaths. And during much of our time period, actually, smoking was allowed in the prison in Michigan. So it's not that these are zero, they're just mostly not as large as those. We don't see much other than this one little thing for cardiovascular disease on cumulative time, and it's negative, right? So the doctors you talk to would say, well, people are getting access to their medicines for heart disease in prison, so they're getting some reduction in risk. The churning in and out of prison is, as the literature would expect, largely driven by increased risk of overdose and homicide, and to some degree by this very large catch-all other non-infectious diseases category, which is kind of a real hodgepodge, unfortunately. So implications. Prison has countervailing effects on mortality. In order to see them, we need to pull these apart. Though they do kind of operate as we'd expect to see from the literature for the most part. The negative effects of prison seem to be largely due to churning. Again, right, that revolving door has important implications for other things. The big caveat is that our observation time is not that large for looking at mortality, right? We're not looking at people aging into that far into ages where things like cancer and heart disease would be much more prevalent causes of death. So could we intervene to prevent these kind of churning problems? And then I guess the last thing just to keep in mind is that these mortality effects are, we can think of them as prison effects, but they're reflecting just as much the risk that people experience in the community when they're not incarcerated. And both their risks of overdose and homicide, but also the state of the healthcare system for the poor and their access to healthcare. Right? So it's sort of a sad irony that that many people are going to get better health care in prison. As bad as prison health care is, they're going to get better and more consistent health care in prison than they do out in the community. This is also mostly before Obamacare and expansion of Medicaid, and especially the expansion of eligibility for mental health services that was part of Obamacare. Okay, so I'll stop in a minute. So we need to keep, this is just what we're going to keep working on. We're going to sort of further refine these cause-specific mortality models and focus more on this criminal justice contact to try to figure out who's most at risk of, especially of this overdose, given the current interest in the opioid epidemic. We have a paper that's under review now that I haven't showed you, that looks at violence specifically, not just any crime, but violence. And interesting, shows there's no preventative long-term effect of prison on violence. So maybe Jeff Sessions will read the paper, I don't know. Maybe not. And then we can also look at other types of criminal justice involvement with these data as well that we're in the process of doing. Okay, so thank you so much for your time, and looking forward to hearing your comments and questions.